I didn't know in 2010 that I was entering into a crazy world of tobacco control. I'd spent, as Jeannie indicated, a lot of my life working on drugs harm reduction, and became interested in tobacco harm reduction around 2008, 2009, 2010, and I thought, well, wow, here is the solution to the world's smoking problem. I think it ticks all the boxes. It's all this kind of world health and public health boxes in helping people to change, putting control in the hands of people. And it seemed to be such a simple solution. And I thought, well, wow, all my public health colleagues are going to agree with me. But I soon found out that even though many of them were pro-drugs harm reduction, pro-drug law reform, when it came to tobacco, there was another hat, very different beast. So some of those friends of mine who'd been very active and taken great risks in pursuing drugs harm reduction, when it came to tobacco and safer nicotine products, very different view. And it's a crazy world. I mean, I thought I was heading for I've retired a couple of times, and my last retirement was 2010. I'm not sure when my next will be, but all my team say I should never retire. But since 2010, there's really sort of strange things happen. I mean, I find myself on a WHO blacklist. I find myself with an entry in Tobacco Tactics, the University of Bath Tobacco Tactics website. And of course, amongst our friends, if you have an entry there, you're doing the right thing. And there are some people in the room who are saying, why don't I have my own entry on the Tobacco Tactics website? Anna Gilmore, please give me my page. And there are the niggles and the hurts. I've got friends who are banned from speaking to me because I'm working in tobacco harm reduction and I'm funded by the Foundation for a Smoke-Free World. There are people who are banned from coming to the Global Forum on Nicotine for that reason. I mean, this is pretty crazy. So there are many groups trying to stop tobacco harm reduction. They will slow it, and there are setbacks, but I think the end of combustion is in sight for tobacco, just as it is for fossil fuels. I mean, THR is being driven by three things: the new nicotine technologies, consumer interest, and good regulation. Those are the three drivers. And perhaps that's why public health has a problem with this, because public health is quite happy. I mean, I was a left-leaning public health social scientist, all that stuff that I had to leave behind a little bit. But, public health is sort of happy in telling what people are doing, then getting a bit annoyed when they don't do it, but feels very uncomfortable when people start doing things without being asked to by public health. And I think that's one of the issues here, the sort of lack of ownership by public health and by the medical establishment, because it came from a very different direction which they couldn't easily control, and so the response is to raise the concerns, raise the fears, the FUD, fear, uncertainty, and doubt. So, positive side, tobacco harm reduction is here for good. It's an easy fix that will have a massive impact on world health. It's a free gift. I mean, it's the companies that meet the R&D expenditure and the manufacturing costs, and it's the consumers who put their hands in their pockets to buy the goods. So it's one of those classic but often unremarked upon health interventions that doesn't require government expenditure. When I was working on drugs and HIV prevention, HIV/AIDS arena, all the time you're trying to persuade governments and foundations and so on to come up with the millions of dollars to launch interventions to help people to change their behaviour. This doesn't need any money at all. Tobacco harm reduction is simple. It requires appropriate, acceptable, accessible, affordable products and regulatory frameworks which ensure product standards. And tobacco harm reduction saves lives. We don't need randomized controlled trials to show that lower risk products lead to less harm, just as we don't need RCTs to prove that avoiding petrol and diesel is better for the environment. Nor do we need to treat smokers for their addiction, just as we don't need to treat people for their addiction to driving cars. So, The sooner we move from harmful to safer delivery systems, the sooner we'll reduce smoking-related harm. But what a mess this has become. I called this talk initially sort of going forwards and going backwards, because some days it looks like we're going backwards, other days there are things that are good. But many days the prospects have looked bleak. The Australian government's bizarre plan makes nicotine for vaping only available on prescription. That's kind of like going to my GP to get a prescription to go to Starbucks, and I don't want to do any of those things. We've got the FDA in the States, which is pursuing a rule-driven bureaucratic nightmare, which is leading to the massacre of nicotine products, of small businesses, and the consumer choice. It seems to me the FDA doesn't understand nicotine vaping products. Several European countries are considering flavour bans and taxes. The WHO continues its campaign against vaping, including scandalous image. I mean, this is kind of kiddie vape porn. Have you seen those WHO images of kids vaping? All this moral panics about kids vaping. The only people who portray kids vaping is the WHO. This is absolutely and the campaign for tobacco-free kids. And it's wholly inconsistent. The WHO position in this field is wholly inconsistent with its adoption of harm reduction for other health issues. The campaign for tobacco-free kids, riding on its $160 million from Bloomberg to fight flavours, has succeeded in pushing falsehoods about the supposed danger nicotine poses to America's youth. I don't know what there is about the preoccupation with kids in America. In 1971, my late friend Jock Young coined the term moral panics for these sort of scares about kids and other things. And the US seems to have had recurrent moral panics about kids, whether it was juvenile delinquency or rock and roll or internet screen time, violent video games, and now nicotine. So it's kind of surprising that anybody in the US gets to adulthood unharmed, or maybe they don't. So, and then you've got this foul campaign from the Truth Initiative. I mean, anybody who calls an organisation the Truth Initiative and hasn't read 1984 needs to go back to that book, to the Ministry of Truth, or go to Russia and Pravda, a newspaper called Truth, completely the opposite. Calling something the Truth Initiative, and they now have this foul campaign, the fake product called depression sticks. It's a false account, it presents depression sticks, a vapor device, falsely claims that nicotine causes mental illness. This campaign harms young people. It's muckraking fantasy. So what a mess these organisations have created. I hope that one day there'll be class actions against these organisations from people forced back to smoking because of this propaganda. But it's not all good news. Not all bad news. Did I say good news? It's not all bad news. There is some good news. Despite all the discussion about bans, the number of countries banning hasn't really increased. There are 36 countries that ban vaping products. The majority either regulate them or don't do anything. Going forwards, we have, as you've heard from Derek, the FDA issuing PMTAs for general snus, IQOS, and a small number of e-cigarette products, but of course the denial of the marketing orders for many e-cigarette products. And bizarrely, a few days ago, approved a discontinued oral nicotine product. Anyhow, those PMTAs for snus and for IQOS are important. Going forwards, we know that safer nicotine products can become rapid substitutes for smoking cigarettes. Sweden, many years back, reached that 5% smoking rate, which is taken as indicative of the elimination of smoking, and has the lowest tobacco-related mortality in Europe. In Norway, women under the age of 25 have an extremely low rate of smoking. 1% of young Norwegian women smoke, but around 15% of them use snus. It's been a substitution of snus for smoking. Japan, massive decrease in cigarette sales, a drop of around 40% since the introduction of heated tobacco products. And going forwards and looking positive, the UK is progressive And I think we've succeeded in normalising vaping. But of course, we still ban snus. So in London streets, you'll see people vaping rather than smoking. There are vape shops in even the smallest towns. There are no laws preventing vaping in public places. It's up to the owners of premises to decide what to do. But even here, in cricket clubs, they often make the wrong decision. I mean, the wide open space of the Surrey County Cricket Club, of which there are some members here today, you're not allowed to vape out in the wind there because they decided that vaping is somehow incompatible with watching cricket. Drinking isn't. Okay, so not... In the UK, e-cigarettes are controlled by light touch regulation. They're included in the annual NHS Stop Smoking campaigns. A few NHS hospitals have vape shops. There's no moral panic about vaping except amongst a tiny number of public health dinosaurs who've been a bit quiet of late. The number of vapers has increased steadily as the number of smokers has declined. For all that, there are some troubling signs. The recent report for the All-Party Parliamentary Group on Smoking and Health, written by Ash and the Spectrum Consortium, has no positive recommendations on e-cigarettes. They're discussed, but none of the recommendations are positive about e-cigarettes. The only recommendation in there, or the two recommendations, one is the ability to ban supposedly kiddie attractive flavours. So what is going on? Because the Ash surveys show that e-cigarette use amongst young people is almost absent here. So why is Ash importing a moral panic from the US? I don't know what's going on there. So as you've heard, and as we show in our report, anti-THR sentiment globally is nourished by big philanthropy. I don't think it's a kind of a command and control thing that we have to fantasize, but certainly the money goes to those who are anti-THR. And if we can just look at this slide, this photo shows the relationship between WHO and one of the largest funders. As you can see on the slide, it has Bloomberg philanthropist, it has Michael Bloomberg and Dr. Tedros from the WHO against a backdrop of Bloomberg philanthropists and WHO logos. You can't see the slide because...
It's not yet showing.
I know it's not showing because we're not allowed to show it. We use the photograph. The next slide, please. We've got a cartoon of it done by our cartoon team in Warsaw. We use the photo. There's a photograph on WHO social media, shows Tedros and Bloomberg shaking hands, both smiling, against a backdrop of logos, Bloomberg Philanthropies, World Health Organization, Empower. And it's used by WHO in promoting their work and their relationships. We've used this photo in the event promotion for today. And a week ago, I had a letter from Bloomberg Philanthropy lawyers threatening legal action if we used the photograph in our work. So these are stupid niggles, stupid nonsenses. And in fact, if you go to page 41 of our report, you can find the link which takes you to the photograph on the WHO Twitter account. So I can't show it to you, but there you go. So there are little stupid niggly attacks like this, but there are malicious attacks as well. I've mentioned the bans on friends speaking to each other. The pseudo investigative journalists fed money and stories by the Bloomberg-funded groups at the University of Bath and at Vital Strategies. Bath has contracts with journalists on smoking and THR work. It includes what I call academic apartheid, the no platform and the exclusion, and some of it is clearly bonkers. The Centre for Good Governance in Tobacco Control prohibits participation in its events for those with tobacco industry contacts to the 4th degree of consanguinity. Now, you need to look up what is the 4th degree of consanguinity, because it goes sideways to your relatives, but it also goes back. So the 4th degree of consanguinity goes back to your great-great-grandparents. So there's a kind of and transgenerational theory of contamination going on here. My great-great-grandparents were born in the 1820s. I don't even know their names. I had to look it up on Ancestry Plus just to clarify what I was saying. I don't even know what they got up to. So this theory that you can't engage with events because of your links with the tobacco industry are clearly mad. There's an event next week, an FCTC report being launched next week. It's announced on Twitter today. You go on there to join the online event. First question, have you got links with the tobacco industry? So what is all this about? You know, you have events and you ban people. We don't do that. We welcome everybody. So this over-interpretation of Article 5.3 from the FCTC is really become a part of a pathology of tobacco control extremists. It's what Clive Bates described as a homeopathic concept of contamination. And unfortunately, you know, many academics are complicit in this. They don't protest these aggressions. I don't know if they're bullied, scared, I'm willing to rock the boat, or perhaps they agree wrongly that Article 5.3 applies throughout academic advocacy, work, and private life. So, what of the upcoming Framework Convention on Tobacco Control Conference of the Parties? Well, COP is shrouded in secrecy. It's antipathetic to those companies that are now part of the solution to smoking, paranoid about the public, driven by anti-THR rhetoric in conjunction with the World Health Organization, and steered by a relatively unaccountable secretariat. The Framework Convention itself is wide-ranging. It includes supply, demand, and harm reduction, the neglected area, and it's flexible. Built in is the need to respond to scientific developments. But throughout the history of those meetings, harm reduction has been neglected to such an extent that, in fact, I think now that WHO and FCT have lost ownership of the harm reduction element. As Derek Yak says, the FCT is frozen in time. Many have called for it to be abandoned or significantly revised, but states have no appetite for this. So what has to be on the agenda is change through its interpretation and implementation. First, parties to the convention, the countries that own the FCTC, must press for changes to the 5.3 guidance. Second, FCTC, WHO and COP deliberately ignore that third pillar of the convention, harm reduction, and indeed campaign against it. So I think governments must press COP to give harm reduction its rightful place as is mandated in the convention in 1D. Third, there's a lack of transparency. There are two framework conventions. There are only two framework conventions. One is on climate and the other is on tobacco. And the contrast between the climate COP26 event next week and FCTC COP9 is stark. The head of the FCT Secretariat has just tweeted about the parallels between the FCTC COP and the climate COP, saying that we're both battling big industry. But what she forgets is how different the FCTC COP is from the climate COP. If you go onto the climate COP website, it invites you to get involved. Most of the proceedings are online. 2,500 organizations are admitted as observers to the climate COP. FCTC COP has just 21 observer organizations, and there are attempts to join as observers, and only today we heard that NNA's bid to get observer status was rejected, along with the International Network of Nicotine Consumer Organizations. But admitted as an observer is the Tobacco Control Research Group at the University of Bath. So consumers no, anti-THR people, yes. COP observers, as was mentioned this morning, include a whole range of groups, business and industry, farming and agriculture, and so on and so forth. Many of them are exhibitors and sponsors. Most of those groups are welcome at Climate COP. Most of the groups who are welcome at Climate COP are banned from Tobacco COP. So, and as we know, FCTC COP richly excludes the public and the media. And despite being virtual this year, the proceedings are not online. So, Things have got to change. Taxpayers pay for COP and for the FCT Secretariat, and the UK here is key, and we've been pressing UK politicians and government to do something there, but it doesn't look very positive. But the fact is that the UK pays 70% of the FCT Secretariat voluntary and project money. And as one MP remarked to me, if we pay that much, why don't we get to appoint the head of the FCT Secretariat? So there's beginning of thinking there that things have got to change, and that the UK, now it's unbound by the Euro bloc vote, can be a force for change. That's what we hope, that UK and other countries can take back control of COP. But the indications in an answer to a parliamentary question last week are that the new minister for this, that, and everything else, I don't know, the minister in charge of this is adamantly not going to rock the boat this time around at COP. So I've nearly finished. Before I do that, I'd like to thank Harry Shapiro for writing Fighting the Last War. I'd like to thank all the KAC team who work on this in many different ways and have been involved in producing the report. I'd like to thank Suli Castro for organising this launch, and I'd like to thank the foundation. She's waving at the back. Hi, Suli. And I'd like to thank the Foundation for a Smoke-Free World for funding our work. So, are we going forwards or are we going backwards? As I say, some days the prospects look bleak, but overall I think the prospects are good. I think tobacco harm reduction is unstoppable. It's being driven by a dynamic of good products and consumer interest. We have to recognise that transformations in tobacco consumption have often taken a very long time. After the advent of the cigarette rolling machine, it took about 50 years for the manufactured cigarette to replace other forms of tobacco consumption. So the question for us is really not whether this transformation to safer nicotine products will happen, but the speed of transition, and of course, the longer it takes, the more deaths. So THR can be slowed, but not prevented. The question, I think, is not whether safer nicotine products will replace cigarettes and other harmful tobacco products, but when. So that's why I like to think that tobacco harm reduction is here for good. Thank you.